morning and welcome to Viewpoint, your program of personalities, politicians, and perspectives. Today we have a great personality. We've had him on here before. That's why he's back. And we have a perspective or two. I'm not sure what they're going to be, but we're going to come up with a perspective. Good morning, Mrs. Busby.
Good morning. How are you today?
Nobody told me.
You got the punies.
Nobody told me. I have no idea. Anyway, we're going to keep forging forward. Kudos. The only kudo I can think of this morning is the Lincoln County Board of Realtors have caused a sign to be or will be put up at the entrance to the old Chautauqua grounds. That's next Monday. That's going to be a little ceremony out there. I don't know. You're going to dedicate a sign. I presume that's what we're going to do. Those of us old timers who are running around Chautauqua buying nickel candy bars and nickel Cokes back in the 30s. Some of us might be there and have a memory or two. So that's going to be at 1 o'clock next Monday. So thank you, Brenda Short and the Board of Realtors. That's a nice thing they're doing out there for the community. A lot of history out there at Chautauqua grounds. Boy.
And you know, we who are the Johnny-come-latelys around here don't know that history, Bill, the way you do. And I think we should dedicate ourselves on a couple of these Wednesday mornings to talking about that, because that was the season when you
I'm going to talk about that just a minute right now. You know, we had a very palatial cabin out the family, my grandfather's. We had a 4-bedroom home. Well, actually, it wasn't 4 bedrooms. It was a living room. It was about a 10 by 12 living room, and you had a wire bisecting the room both ways, north and south and east and west. And so you pulled curtains, and suddenly instead of one big room, you had 4 bedrooms.
There you go.
So we had quite a palatial place out there.
Yes, you did. All kinds of room.
Speaking of palatial, we have a young man here that ought to be introduced because he's driven all the way up here. He had to stop at Lawndale to get a bump on the way. So Don has been kind enough to give us his time of his busy day. So go right ahead and let's get this gentleman on the air, Judith K.
Don Cavi is and has been the fearless leader at the Logan County Department.
A rock.
Well, thank you.
Of public health, and trying his darndest all by himself without any help from the rest of us for ourselves to keep us healthy. And there are several things that we want to talk about this morning in that regard. One is the flu shots, the shingle shots. And I would like to ask you, Don, I've heard the argument put forth that it's a good idea to legalize the marijuana on several levels, recreationally, that is, because it's already legal medicinally. I'd just like to ask you, as a man who looks after the health of this county of us sometimes wayward people, what's your opinion of that?
Well, it is a controversial issue. And we're, as a public health community, we're collectively looking at it right now. Because if you look at there is some evidence out there to show, obviously, marijuana has some can impair your mental, as far as your reaction. It could
your judgment's kind of impaired for a bit. Yeah.
Absolutely, it could cause other issues. There's a lot of health issues. It's just like tobacco, and you have that does raise a flag. It could, especially with young kids, they can get addicted to it. Even older folks. So it is an addictive drug, and there's some evidence to suggest that young women who are pregnant, that can impair the child if they're smoking marijuana. So there are some negative health issues that are in question with marijuana use, and so from a public health perspective, you can't just jump in and say, hey, this is great, let's go ahead and legalize marijuana. But I mean, we look at other states that are legalizing it, and
And there are a lot of them, aren't there?
Yeah, and I think Colorado is probably the one that everyone thinks of, but there are several states, absolutely. But this is a good question you're asking, because we in public health, and I don't speak only on my behalf, but in terms of all the administrators statewide, we're looking at it right now. We don't want to just jump in and say, let's do it, this is great, because there are some red flags. And right now we are kind of contemplating this issue, and because as you know, we have a new governor coming in, and my understanding is that the governor coming in is kind of leaning towards legalizing it. So there are two questions. Number one, should we legalize it? Number two is, if it does become legalized, how do we address that? And so from a public health perspective, our approach right now is, maybe we don't want to jump into this right away. We want to maybe look and see what's going on the other states. Let's look at the evidence of what's going on in Colorado, and I want to say it's either Oregon or Washington and some of the other states that have legalized it. And what type of health impacts is that having on those communities? So I think it's kind of a let's stand back, let's take a look at this before we just jump into it, kind of an approach.
I don't think they did that with Prohibition when they made the purchase of alcohol legal. I think they just went ahead and grabbed hold of the D ring and jumped right out of the airplane and hoped that the chute would open. By the way, just before we go ahead, may I have another kudo, Mrs. Busby?
Oh, gosh, please.
To the staff out there at our health department, Mr. Cavi runs a real good ship out there. I don't think he's responsible for the attitudes of each and every person out there, but if he is, he's doing a whale of a job. You folks up front on the firing line that meet us when we go in and get our shots and so forth, just a pleasant atmosphere. You really run a good ship out there, Don, and I think all of those ladies that are, even those that are giving us the shots, boy, they hurt. No, they do a great job. You have a good staff out there. Your nurses, your receptionists, and all. We're lucky to have that facility out here.
Yeah, no, I appreciate the kind words to me, but. And as you kind of reflected here, it's the staff, and they do such a great job. They make my job easier. So I am thankful that I have great people working at the health department, because they're the ones that really they're where the rubber hits the road, and they're the ones that do an outstanding job. It just makes my job as an administrator that much easier. So, but thank you.
I remember when that health department issue first came up. And it, just like everything else, there were a couple sides to that, Mm-hmm. But it's moved along, and it was the right decision on the part of the decision makers. A couple of the things that you're working with now in this season are the flu shots, for instance. Mm-hmm. Do you have any way of tracking what percentage of us take advantage of them?
I did a little research on that. They have the federal government Healthy People 2020 initiative, and from what I looked at in Logan County, approximately close to 40% of the people are getting their flu immunizations.
How does that compare with the rest of the Illini?
It's kind of in the neighborhood.
Is it?
I think it's a similar situation in a lot of
Rogers had a
counties.
good neighborhood.
The what?
Mr. Rogers had a good neighborhood.
Yes, he did.
Yeah.
But yeah, that's the thing. We really want to get the word out there that 40% is the federal government wants that to be up near 75%. Or 3/4 of people getting their
But you
flu
can lead a
shots.
horse to water, but you can't make them drink.
That's absolutely
You've
true.
offered the shots, and I don't know what else you can do.
Well, I can say that last year, as you know, it was a pretty bad flu season, and we had just in Logan County 481 cases of flu alone. That's just in Logan County. That was, like I said,
That's
last
reported.
year. Yeah, and 55 residents required hospitalization, and that was
That's a bunch.
And last year at the health department, we gave about, I want to say, between 16 and 1,700 flu shots. And this year we're up over 2,000, which is good. So we seem to be getting more people immunized. There's still a lot of work to do. Credit to our staff. Our nurses are working hard to do off-site clinics, and they've gone around to the different communities here, and some people have taken advantage of that too. So, but they're working hard on that.
You've heard the negative comment, I'm not going to get one of those shots, I really got sick. Well, I think that may be a coincidence. What's your opinion about that, Mr. Cavi?
Yeah, I mean, there are some there are potential side effects to getting a flu shot. One of them is you might get a low-grade fever. From personally from me and from people I've talked to, it's not, the effects are not really felt that much.
That beats the socks off of going to the hospital, though.
Well,
absolutely. That's one of the key selling points with getting the flu immunization is, if you're immunized and if you do get the flu, it may not be as severe as if you didn't get the flu vaccine, where potentially you can exactly, Judy, avoid hospitalizations. And the other important thing is, when you do get your flu shot, you're also protecting the loved ones that are around you too.
That's right.
There's a lot of positive impacts to getting your flu shot.
Yeah, you don't want to be responsible for giving your little great-grandkids the flu, do ya?
No, stay at home. 648-5510. Somebody may have had direct personal experiences with this matter. It's a very personal thing. One of the things that you see out in public is people who don't use good judgment if they have the sneeze or the sniffles to cover themselves. That's just a matter of good sense, but there's a lot of that's lacking out there. I see that often. You do too, Mrs. Busby. You don't wash your coffee cups enough for me.
Just pick.
Yeah.
Let's take a shot with the what do you call that follows your nerve endings, and it's...
Oh, you're referring to the shingles?
Yes, I am.
I know a fellow who...
Now, I've never had that, but my mom did, and it was nasty.
Yeah, it's terrible. It's 1 out of 3 people over, I want to say, age 60 statistically will get the shingles.
1 out of 3?
Yeah.
Holy
that's
Friday.
It's if you're not immunized, so it's really important to make sure, if you have had the chicken pox, if you think you've had the chicken pox, it's a good idea to get the shingles vaccine, especially if the vaccine out now is recommended for people over age 50.
Well, Bill, that sure catches us, doesn't it?
Well,
we are over it.
Well, and you're right. I mean, people that have had it, it's extremely painful. And
when I was a kid, we had every communicable disease there was to know. It showed up at my house, and in those days, they put a quarantine sign on your house.
Yeah.
Up there and tap a little cardboard sign, put up at your house, mumps or measles or whatever it was.
Well, now you mentioned the business of having had the chicken pox, and I've heard that before, but what is the correlation?
Well, and again, getting into the specifics, the best thing I can explain is that, if you have that virus in your system, that it goes dormant, but it can reoccur over time. And that's why by getting the shingles vaccine, basically it's keeping your body in check, keeping the vaccine or keeping the virus from becoming active again. So
heck, but when I had the chicken pox, it was probably 70 years ago.
Mm-hmm.
That virus has got to have escaped somehow.
Yeah, I'm not aware of all the research that goes into that, but all indicators are, you're better off just playing it safe and making sure you get your shingles vaccine.
And do you offer that at the health?
We do right now. I mean, the stock we're out right now. Unfortunately, it's been
How long will it take to replenish
and
that?
it's actually very hard to find right now. So we're
well, because it's the season. Probably.
Yeah, as soon as we and that can be given year round, but we just can't. It's hard to find right now, and I don't know. I know, speaking for us, and I believe that nationwide, folks can check with their providers too. But as soon as we get the vaccine in stock, we'll make sure the public's notified. But we kept it stocked, and believe me, if it was available to us, we'd have it now. So we're doing the best we can. But once we do get it back in from the manufacturers, once we do receive the stock, I'll make sure the word gets out.
Don, when we last visited, the economics was a big factor in your office. I'm certain that's true today. You'd had some layoffs, which was unfortunate due to the economy, the economics of your particular department. Where are we in that regard now, as far as you having enough money to staff your full staff out there?
Yeah, we. 4 years ago when I started, we were at about 34. And we're down to about 21, 22 employees now. The dental clinic is now part of SIU, and then home health. So those are the two areas that we had to. So fortunately, we still have dental in the community, but they're operating under their umbrella, SIU's. But the home health, that's one area we did have to cut loose with, unfortunately, but we're managing okay. We do have some tenants that are using some of our building space, which does help. And we're out marketing more, and so financially they're better. I'm not going to say they're perfect. We're not in the industry of making money. We're, if we can break even, that's, we're a non-for-profit. But I can tell you, we're definitely better off now than we were 2 years ago. At least we have a state budget right now, so that's helping.
As you talk with other administrators around the state, are you and they experiencing the same issues?
Yeah, it's definitely it's not just the Logan County issue, but health departments statewide they're always looking for ways to generate financial stability. So that's true. It's just not Logan County.
Mm-hmm.
Now, as far as the table of organizations is concerned, to whom do you report, Don?
The Board of Health. We have an 8-member Board of Health,
and they are responsible to whom?
The county board appoints them. Mm-hmm. So I guess that's where it trickles down from. But they're basically the Board of Health is our governing body, mm-hmm. and they're the ones that I report to. And they've been a tremendous support to myself and the agency. So we're privileged to have them.
Well, it's a real blessing to have that facility out there over on 3rd Street. As I say, it's certainly, when you walk in there, you're not intimidated at all. You're greeted by people who have a nice attitude, a helpful attitude, besides just being pleasant, and there's no big wait time in there.
That's a huge benefit.
Particularly folks with dragging kids around.
Yeah, we've actually had people from other counties come to our health department because, some of the other counties, there are waits. Or they have to schedule appointments, and they can come right in, get seen right away. They don't have a 2-hour wait, and we've had compliments on how clean the health department is, and so it's always great to we welcome people from other counties. We certainly have the resources to serve them, and it supports Logan County, it supports the health department, but we're also helping individuals. So that's what's important.
648-55. Oh, I stepped on your line, Mrs. Busby. Go right ahead.
Not a problem.
No. Hope that didn't hurt.
Not too bad. Now, what is your main source of financing? Is it tax money, or is it the nominal fees on the services that people get? How do you support yourself?
Well, both. We get federal and state dollars for our programs. We've got it's called the FEP grant, Public Health Emergency Preparedness Grant, and we have somebody on staff who does all of our emergency preparedness. So we get federal money for that. We get our WIC dollars, which is federal money.
We have a way of supporting ourselves here at WLCN also Viewpoint. It's called sponsorship, and without them, we ain't going to be here. So we'll take a few seconds now, and 648-5510, time to, but pay attention to the commercial. Don't take your time away from that. If you have any questions for Don Cavi, representing our health system, 648-5510. Go ahead, Mr. Aish. Right back live in the studios here, having paid obeisance to our much appreciated sponsors. Our guest this morning, my guest this morning to my immediate right is the lovely Judith K. Busby, co-host and co-owner of Viewpoint, that scintillating program you all hang on the air for each Monday morning, each Wednesday morning at 8:15. Because the coffee pot needed to be tended, you had to do something. Your guest this morning is Don Cavi. We appreciate you taking your time with us. Don, representing the Logan County Board of Health. Judith K. asked him about funding as we were going off air, and I thought that might be a good time to fade away.
Yes.
As long as your funds don't fade away.
Yeah, we were, just talking about, we do get a lot of grants for different things, like through our WIC, through our preparedness. We've got a HealthWorks grant, which is a program through DCFS where a program that provides continuing medical care to children who are taken in as wards of the state. And we're a lead agency for not only our county but 12 other counties as well. And so we have a staff of 3 that manages that. So we work closely with the DCFS on that program. We get a public health grant from the state. So a lot of our money is grant, but we also get money from the county as far as our tax levy. But a significant percentage of our funds come in through, private and through our clinic. Just what we offer.
You mentioned
there,
dental
environmental
care.
health. Because we issue food licenses, and so we have quite a bit of funding that comes, outside of the grants too. So,
Do you do your grant writing, your petitions for grants right here at the office? Who's the poor soul who got that short straw?
well, it's kind of
That's an art.
It's a combination of the department director works on part of that grant application, but the finance director also works on that grant application, and she plays a huge role in it. She does all the financial breakdowns, and it's all done electronically. We submit it through directly to the state. There's a grant program that we can electronically submit. So they've made it a little easier for us. There's not as much paper, but I shouldn't say easier. There's still some tedious things about, everyone thinks technology is always easier, but sometimes it's not. But they do a great job with that. But yes, so it does take a team to, apply for the grants. And the staff do a great job with that.
Don, you mentioned dental care. Tell us about that program. I know it's not new with you at all, relatively so in the community. So let's touch upon that. A lot of people may not be aware of that, the availability of something that we kind of have a tendency to ignore.
Yeah,
and that's our dental care.
Well, the dental program was part of the health department, and then when Southern Illinois, it's almost been 2 years now since they came in. They took it under their wing. But we were looking at, I want to say, close to 20% of the community was taking advantage of the dental clinic that we had at the health department, because our clinic was the only one that accepted Medicaid, and so I'm just and they do a full range of services in our dental clinic. It's not just cleanings and fillings, but they do. There's a lot of things. But anyways, that's been a huge asset to the community. I'm thankful that SIU has been able to retain that, because now through our facility we can still offer that service. It's just not managed through us anymore. And like I said, it came down to financials, but fortunately we were able to find a way to keep that in the community. So, and like I said, they have probably over 6,000 patients that use that.
That's a lot of people.
Yeah, it is. So it's been a great program.
Yes.
answers a real need for a lot of people out there.
Well, and it is certainly part of your health. If you've got tooth problems, you got a health problem.
Yeah, and I do know that there's a whole list of health issues if people don't get the proper dental care, that it could lead to all sorts of other things. Mm-hmm. I've heard things like heart disease and other. I remember looking. There's a list of about 7 or 8 different health issues that improper dental care can lead to. So it's various cancers and all sorts of things. So which I found that interesting as I read through that. So but we're glad to have it, and we're certainly glad to have SIU's medical clinic too, because one of the public health initiatives is to promote access to care, and by having SIU and their medical clinic in our facility, there's a lot of people that now can get the health care that they need for their families. So we're glad to have them as a partner.
How many patients do you see in the course of a given amount of time, a week or a month, however you keep track of that?
Oh, that's a good question. I don't have a number for you, to be honest with you.
But see a lot of people.
We do see a lot. Our busier time is usually starts in the summertime, because then all the school kids have to get their back to school immunizations.
Yes.
So we see a huge surge in the summertime, and then in the fall, people want to come in and get their flu vaccines. Things usually taper off a little bit between January and May. But we do offer, like I said, we have other types of services that we provide people, and we do see a lot of WIC clients on a daily basis.
Yes. Women, infants, children, right?
Yes, correct.
And what exactly purpose does WIC serve?
Well, it serves a population of an underserved population. People that are in the program have to qualify and meet federal income guidelines. Mm-hmm. However, the program centers around nutrition for infants, young children up to age 5, and for women who are pregnant. And also there's a focus in our WIC program on the benefits of breastfeeding as well. And we do have a breastfeeding peer counselor who works at the health department through our WIC program, who provides education and does a lot with that. So we're really trying to promote breastfeeding.
That's interesting. It just kind of a part of the goes around comes around business, of course, everybody used to do it a couple generations ago, but even flow reigned supreme all the years that I was having my kids. Mm-hmm. And now that's turned the corner again.
Yeah, I think part of it is, we're such a convenient society, and, it's not as easy to, and especially in a public place for a woman to breastfeed. It's much easier to pull out a bottle and have it ready to go, And so we do have a room in the health department where nursing moms can, mm-hmm. do their thing there. And I do know, there are other public places that it's becoming more available, which is good.
Mr. Cavi, earlier in the program, marijuana was discussed, which leads to that broad question of addiction. Do you see a lot of addiction or much addiction in patients coming to you for whatever the addiction may be, booze or drugs? Which is, marijuana is an addictive drug, I'm certain.
Yeah, I think it's just in general, we see, a segment of the population that's typical everywhere. It's opioids are an issue everywhere you go. And
well, it's a vicious problem in this country.
Yes.
Economically, it's a huge factor. Mm-hmm. Right here in this county, we spend a lot of money trying to interdict opioid traffic and so forth. And it's a lot of resources. And at the same time, that takes investigative resources away from other things that perhaps ought to be investigated. And addiction is a terrible problem. Those of us who don't know anything about it can't really understand.
Yeah, we're making that one of our 3 priorities for 2020 2020 to 2025 is drug abuse, mental health, and obesity. And I know through the hospital and their foundation, they have a committee that is a task force committee that's committed to tackling the drug and opioid issue. I do know there's a lot going on with the local law enforcement, the Safe Passages program, where if somebody has an opioid issue and they can come into the police department and they're not going to get incarcerated, but the police department will work with them to help find the services that they need. It's, I think law enforcement is thinking, maybe it's better to be more compassionate, because just to take them and lock them up isn't going to do any good. So that's one of the partnerships. And then with the Narcan too, we've, as a health department, we've educated law enforcement in the community on administering the Narcan, which is that drug that you take that counteracts the effects of the opioid, heroin in particular. And I know many lives have been saved in the county alone just from police officers that have administered that.
All law enforcement people in the county of Logan carry the Narcan?
Well, I know we've the city and the county do, and I believe, and I can't say for sure, but I think it's pretty accessible throughout the county at this point. We've trained a lot of police officers in turn, and I believe here in Atlanta, and I'm not 100% sure, but I do know that it is available throughout the county. But I can say for sure Lincoln, the sheriff's office, and the Lincoln Police Department have all been thoroughly trained on it. And in addition, the county did put money aside a couple years ago to purchase Narcan, and there were donations from local groups, so we were able to supply the police departments with Narcan. And we're hoping to continue to keep that going, so they'll have that on hand. So, but those have been some effective programs. I mean, it's the only problem with giving Narcan, it's not teaching how to prevent it.
That's immediate stopgap for somebody who's about to die.
Yeah,
you got to be alive before you can be helped. So that's a good starting place.
And we realize, education's a key component of it, and I do know as a community we're working on that. Drug addiction, mental health go hand in hand. I know mental health is a huge issue, not only in Logan County but statewide. And we're the county board approved of us to develop a county mental health advisory committee, which I've been tasked with helping organize that. So we're working on developing that. And we're getting some key members in that group. So we're going to explore some options. What can we do to create programs to make Logan County healthier in terms of mental health? How can we streamline people to the services they need? How can we improve access to care? How can we better educate the public? So those are some things that we're going to be focusing on over the next 5 years.
If a person wakes up some morning or in the middle of the afternoon and says, "Boy, I need help," they realize at long last that they are an addict for whatever it is. And they come to your department, and then they seek counseling. Is that the way that would open that subject up?
Well, we don't. We have being a health department, we can make the proper referrals for people that come in with an issue, and our nurses have a lot of experience at, they know where the agencies are that can treat people if they have certain addictions or certain health issues. So, and we're always glad to do that.
You said that for the coming year, one of your three prongs to your approach to health for the county is going to be obesity. Well, we're just coming off the Christmas season where everybody made cookies.
Yeah.
It's tough, man.
Well, here's a man who faced that. He said to himself, "You're getting too heavy, man." And he took on that Nutrisystem program, or whatever it was. Boy, overnight, he became slimmed down. So he solved his own problem.
Yeah, it's been a challenge over the last month though, so I'm trying to get back on the program again. So if I
I don't
can,
think you need it, but that's
well, thank
my
you.
opinion.
You look great.
well, thank you. Thank you.
And do you feel better as well?
I do. I'm sleeping better. I'm not as winded. I exercise too because if you're gonna diet, you do want to supplement that with an exercise program, and that's good for your metabolism rate. Exercising helps speed up your metabolism
Yes.
rate, and so it does benefit to incorporate both together.
It seems to me that way back when the Logan County Department of Public Health was initiated here, obesity was one of the real problems in our county. Is that still the case, or have we kind of gotten a handle on it?
We're still not where we want to be, and I think it's common county across the state too. I think I looked at a lot of the community health improvement plans, a lot of the other health departments, and obesity seems to be the top on their list as far as priorities. So Logan County is no exception. And I'll be meeting with the local hospital here because we're partners, and we're going to work on a plan to tackle the obesity issue. I know they're doing things now in the schools, different programs, nutrition programs for kids, but we want to see in the next 5 years, what further we can do. So we're working on an improvement plan, and we're hoping to tackle that issue and make more strides over the next 5 years. So
Surely starting with the school kids would be a darn good idea because they got a whole lot of years ahead of them, and they can just develop lifelong bad habits or lifelong good habits.
yeah, and I'm a firm believer in that you develop your habits early in life, and it's, to me, that is the school age is the perfect time to intervene with that, and teach kids about the proper nutrition and the dangers of tobacco and those types of things, drug use, and they need to know at that age and learn that it's something that needs to be avoided.
648-5510. Our guest this morning is Mr. Don Cavi, representing the Logan County Health Department. And again, we appreciate you taking time out of a busy schedule, Don. If you had to sit down and prioritize a list this morning and turn it in by noon, what would be perhaps the top thing that you would want to have for your health department besides money, of course? That's the obvious. That's the obvious.
I'd love to have a plan in place how we're going to tackle the next 5 years with our 3 initiatives. I wish I could just stab my finger up and have a magic plan there. Unfortunately, that's going to take months of planning. So, those are the things I would like to see. I'd like to see more people taking advantage of the services that we have at the health department. But how do I plan that? We just have to keep encouraging people, to take care of themselves and make sure they get immunized. So that's not an easy thing, I wish I could answer that question, give you a quick and easy one on that one.
Staffing-wise, how are you fixed? Are you satisfied with your staff? I don't mean the individuals, but I mean with the numbers of your staffs that you have for the positions that are available.
Yeah, I think so. We're happy where we're at now. We're able to handle our caseload right now. We haven't had too many shortages, really. So I think we're good at this point. Like I said, we don't have home health anymore, but fortunately there's other home health agencies in the area that are covering that. So we seem to be pretty good. So.
Well, that's good news, and thank you so much for coming out this morning. We haven't talked to you for a while, and I was remiss. I'm sorry.
Well, I'm always glad to be here, so it's a pleasure, and anytime, let me know. I'm more than happy to sit in with you.
Bless your heart. Thank you so much. Have a good day, Don.
You too, and
Don
Happy
Cavi.
New Year. Thank you.
And to yourself.
Thank you.
Well, we'll close this morning with some sort of a comment. Hopefully it would be beneficial to some of us out there, and simply admonish you to be the reason someone smiled today. Thank you very much, Don Cavi, for being with us this morning. We appreciate that a lot.
You bet.